everybody, it's me again. It's February 2nd, VLCD number 122. And this morning, am I down? I don't know. This is only this is for Fluff, okay? I'm only going to tell you for Fluff's sake because I know she wants to know what I was yesterday. No, I'm actually up, but I'm fine with that. Yesterday I was 118 on my old scale and 119 on my new scale. And this morning on my old scale, I'm 118.4 and my new scale, I'm 119. I guess it's probably the same. I mean, those little suckers are just finicky. So I guess I'm pretty much the same. And I believe I only have 3 days of injections left, 3 or 4. So my LIW is probably going to be on Tuesday or so. Tuesday or Wednesday. This Tuesday or Wednesday. And yeah, so that's going to be exciting and yet scary that I'll be moving into P3. I know I've said this before, but I really am. This is it. And I believe that my LIW is probably going to be 119, and that's fine. I'm good with that. And I think that it was a good plan to just go ahead and extend it so my body had a chance to adjust from inflammation and all that from surgery, and also from the detox bath. Can you believe that it's like 8 or 9 days from it and I still am all marred up? Yep, I sure am. Anyways, little striptease there for you. Speaking of which, yeah, Joe, I'm not a foot model, so unless I set up a pay-per-view page, you're not going to be looking at my feet, buddy. Sorry. Move along. Anyways, somebody had asked me about the tea that I was drinking last time, Squeakerwood, I believe, and it's not organic, and I know how Lynn feels about that, and I agree. I like organic as well, but actually I'm hooked on this tea. I'm a junkie, I admit it, and so I'm not likely to change anytime soon. It's Celestial Seasonings Candy Cane Lane, and they only carry it during the holidays, so I stock up. They still have some around, and it's on sale now. So if you like that type of flavoring, it's a green tea. It's decaffeinated, and it's just delicious. It has like a little bit of, it tastes like candy cane. Anyways, I drink that every day, and at nighttime I've been for like a little treat, I've been having sugar cookie sleigh, also by Celestial Seasonings, and it is also caffeine free. I do have an assortment of teas. I'm a tea freak, and I do have organic teas. I just haven't really found any that are like, you know, amazing flavors that just make me want to drink them, you know, continuously. And that's really how I get my liquids in. I'm not real good at drinking just plain glasses of water. I do try to drink water, but I'm more likely to have green tea. So I know what you guys are gonna say. I'm working on it. Anyways, I think I'm gonna cut down on my daily fruit because my ketone levels have been negative. They were negative the past couple of days, and I did have either apples or the organic mixed berries for my fruit. And so I guess I'm going to cut out the fruit for the next couple of days, or at least cut it down and see if that helps with my ketone levels. I don't know if anybody else is having this, but it's like, regardless of whether, even when I show a loss, my ketone levels are either negative or like really like just a trace, or this whole entire extended round, it's been it's the most that I've had, it was like moderate ketone levels. So yeah, I even thought that they were like defective, and so I got new strips, but no, it's the same deal. Same deal. Anyways, yeah, my LIW is coming up, and I'm gonna start making some plans for P3 foods, so I do the right stabilization, everything goes well, and I'm gonna need support, so I will still be vlogging, and I'm open to all the suggestions you guys have for P3. And I wanted to mention to some of you, and Kelsey's Journey brought this to light for me again. I've mentioned it in the past, but I'll bring it up again. She's on HCG, and I guess she's doing it with a clinic, so her protocol is different. It's 800 calories, I believe, and there's some other foods that she's consuming that are on her allowable list from her doctor. And I guess I wanted to bring that up as a topic for discussion, because there are some people that do an 800 calorie diet. I think there's even a few out there that do a 1,000 calorie diet. And then there's, MOP, and there's strict protocol, and people that mix their vegetables or their fruits or whatever. I don't know. Somebody the other day said that they eat peaches. And I certainly didn't think that was on any of the allowable food groups. So I wanted to put that out there because it's interesting that just me, for example, I just decided to cut out my fruit because my ketone levels aren't showing up. But, according to Dr. Simeon's protocol, I should be able to have my apples or, berries or, an orange or half a grapefruit. So I shouldn't have to cut out the fruit. So there's some people out there that are doing an entirely different menu with, the different calories and everything, and yet they're losing. And I just found that to be really interesting, also some homeopathic and some RX, which also brings me back to my original experience with HCG. As I mentioned to you guys in previous vlogs, I started with a clinic, and they didn't have the right information, so they did not give me the right information. And so my start was rocky. I did not load. And I don't know what, they were doing the injections themselves, so I don't know what amount they were injecting me with, but I do know that I was going to the clinic and they were doing the shots because I was afraid of needles, and because they were closed on the weekends, they would have me come in on Friday and they would double dose me. They would give me 2 shots and tell me that would last me till Monday. So yeah, I know that was not right, and there was also foods that they said that I could eat that I just know will not work with the RX HCG. I don't care who you are. And then in addition to that, in addition to them not telling me to load, and then they didn't tell me that I needed to weigh my food. It was just like between 4 ounces and 8 ounces. Like, that's a huge difference. That's like that's like 1 serving versus 2 servings of protein in 1 meal. So I wanted to put that out there just for kind of like a topic of discussion. We have to take our own journey, and we have to take responsibility for our own journey, and learn from each other and do our research. We cannot just, ask a friend's advice and go with whatever they have to say or whatever this book has to say or a particular doctor. We really have to take, active role in our health and ask questions and explore and keep notes and learn from each other. So I just wanted to put that out. I tend to be preachy. Sorry about that. And this is now in past 10 minutes. So, and some of you have already clicked me off because I heard nobody wants to watch a 10-minute clip. So I'm going to hush on up. That's what I'm going to do. I'm hushing on up. Hushing up.